Hello, am I audible? Hello, 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 hello.
Yes, doctor, you are audible.
Okay. Is there any change needed? My screen is visible. Okay. So, uh, hi everyone. I'm Dr. Grishma. I'm an MDS holder with oral and maxillofacial pathology in oral and maxillofacial pathology. Currently living in New Zealand. So today, the topic is scope of dentistry in Australia and New Zealand. So, uh, coming to the topic, New Zealand and Australia. Sorry, so New Zealand and Australia are neighboring country. You all know the both are neighboring country. They will offer very many opportunities to dentists that we don't know because we are only living in India and practicing in India. We are not exploring much about in Australia and New Zealand. So Australia and New Zealand, why I am saying
Movement.
is because hello, pardon, hello. Okay, the New Zealand and Australia. I'm currently living in New Zealand, so I know the situation of dentistry here because here the New Zealand and Australia are neighboring countries. They are work with Tasman mutual recognition. If you are registered dentist in New Zealand, you can work as a registered dentist in Australia and vice versa. And these two countries they offer a better work life balance. If you are get registration and you are a registered dentist in New Zealand or Australia, you can balance, you can get an equilibrium in your personal life with professional life. That's why the New Zealand and Australia is a better career building country in for dentist, and also better job opportunities they will offer. Because in New Zealand and Australia there is scarcity of dentists, they offer job opportunities and also better payment. If you are a newly registered dentist, you can get 80 Australian dollar per hour, which is about 4,000 INR. So per per day you can score up to 40,000 INR you can earn. So that is the things we need to know about the Australia and New Zealand is the better country for building your career. And also Australian Dental Association and New Zealand Dental Association, they are putting many job opportunities in their job seek app like Seek is the job seek app here in New Zealand. They will provide better career build up facilities also to overseas dentists like us. So next one, so why Australia and New Zealand is better option other than other countries for dentist? Why? Because they both Australia and New Zealand they provide accredited employer work visa AEWA. Is a this visa is actually for skilled migrants. The dentistry is also included in skilled migrant category. So you can get PR, permanent residence, if you are you are get qualified or registered dentist in Australia or New Zealand. So this is the thing you need to know. And also Australia generally offers high salaries as compared to New Zealand. They have a high payment, and New Zealand may have lower cost of living. The New Zealand have lower cost of living, but Australia have much better payment. And also, if I am living, sorry, if you are living in New Zealand, you have get better excellent work life balance, and also uh, you have a much peaceful living situation also. So that is why New Zealand is also preferred country for dentist. So New Zealand is very peaceful country. That's I know because I am currently here in New Zealand, and also New Zealand have excellent work-life balance. That is also I am feeling because I am when I was here, I work as a dental assistant, so I know the work-life balance and also the peaceful country and better payment also. Then coming to dental licensing exam for New Zealand and Australia. New Zealand, so New Zealand itself have no such the licensing exam it's by itself, but they are adapting the licensing exam like NDEB is the New Zealand, sorry, National Dental Exam Board of Canada. It's a Canadian exam, and ADC is the Australian Dental Council exam, and also there is an examless pathway which is called the individual assessment process, which is the one of the examless pathway of New Zealand, which is also coming as under New Zealand Dental Registration Examination, NZDREX. So next one is Australia. Australia have their own examination called the Australian Dental Council Examination. So coming to individual assessment pathway, you all know, I don't know, you know or not, but the individual assessment pathway is actually examless pathway where our degree is equating to their degree, and they will provide a certificate so that our qualification is equivalent to or satisfactory to their qualification. So, but I want to say that this pathway is very less chance for getting Indian dentist to pass or Asian dentist to pass. So here, individual assessment pathway mostly passed by the Europeans and other countries rather than Asians. So why it's happening like that, I don't know, but this is the fact. So here, individual assessment pathway, which is also NZDREX, New Zealand Dental Registration Examination. Here we need to create an account in the New Zealand Dental Council site, and after creating the account, we need to submit our documents like our BDS graduation transcript and licensing registration. So we have to submit all the documents, and also good standing certificate also we need to give. And after that, determination of fitness of registration, so we have to prove our physical fitness and mental fitness. And next is English proficiency test, either IELTS if you need to score 7.5 overall and individual 7 score, and OET A or B grade, either IELTS or OET needed. So then submission of 10 clinical cases where you are the leading clinician. So you need to submit 10 cases. Their format is it's there in their site. You need to go to the New Zealand Dental Council site. You can see. So there are 10 cases we need to submit. So, and next one is assessment of your qualification, training and experience. They will assess by desktop verification of information and online interview. They will call you for an interview, and after that they will final consideration you are equivalent to or you are satisfactory, your degree is satisfactory to their degree or not. So here the cost is it's little bit higher, but here single process, here a New Zealand dollar 8,430, which is about 4 lakh 20,000 something INR. So this is the equivalency pathway, but I am not suggesting this pathway because very less chance to get Asian overseas dentist to pass this individual assessment process. So next one is National Dental Examination Board of Canada. So here it is the Canadian exam. Here three pathway: assessment of fundamental knowledge, assessment of clinical judgment, and assessment of clinical skill, NDECC. So here I'm also not suggesting. My personal view, I am not suggesting this one also because here in assessment and fundamental knowledge, you need to thoroughly know the basics of dentistry and basics of other subjects like anatomy, physiology, biochemistry, pharmacology. You need to thoroughly know, then only you can pass the assessment of fundamental knowledge. And you have only three chances, both assessment of clinical judgment and assessment of fundamental knowledge. You have only three chances. And also assessment of clinical skill, you need to go to Ontario for the clinical examination, practical examination. So the so rest of the examination like assessment of fundamental knowledge and assessment of clinical judgment, you can write within so in the India also, but third exam you need to go to Ontario, Canada. So I am not personally suggesting this one also because of the things that I commented. So next one is Australian Dental Council examination. So this is the exam. This is actually a very good exam because here also in the National Dental Examination Board of Canada also you have to initial assessment, but it take time because you need to submit hard copies of your certificate to the Canadian Dental Board, and they will assess it and then you return it. So it will take long time for initial assessment. But in Australian Dental Council exam, here initial assessment only takes 8 weeks only. So here Australian Dental Council exam consists of initial assessment, return exam, and practical exam. So these are the things you need to clear written exam. Sorry, first initial assessment you need to clear, then written exam and practical exam. Hello. So here, initial assessment is the first step. So before going to that, so here, what is ADC? So Australian Dental Council actually check our factual knowledge. We have knowledge because we cleared PDS or MDS. So we have factual knowledge. They will apply it into the applied knowledge, that critical thinking in the clinical scenario based MCQs. And also we show our behavior in a simulated patient, and that will apply into the clinical setting. So this is the thing that is they check in ADC exam. And so coming to the initial assessment, so coming to the initial assess so no hello, are you able to see my screen? Hello, hello. Okay. So okay. Thank you, Basit. Thank you. Okay. So initial assessment here, how we can done initial assessment is that we need to create account at ADC Connect. You need to type it ADC Connect. So you can go to ADC Connect website and you need to create an account. And after creating that, so you need to identify type of application. The type of application for Indian dentist are skill assessment and registration. You need to select both the skill assessment plus registration. So next one is provide documents to the ADC. So ADC documents, so here they will ask your passport and your passport size photograph. The passport size photograph, they have some guidelines. So you need to follow that guidelines while taking the passport size photograph. And next one, you need to submit your if you are an MDS holder, then also you need to clear general practitioner ADC exam first. Then only the specialist on. Okay, first general practitioner. So you need to submit your BDS BDS mark transcript, BDS degree certificate, and also licensing registration dental licensing certificate. And also, if you are newly graduated dentist, then you are not working anywhere, so you need not submit your work experience. But if you are a experienced dentist, you need to submit work experience certificate too. But if you are a experienced dentist, but you are not work for about 5 years, you need to send an explanation letter to the ADC why you are not working for 5 years. So next you need to submit two reference letter. So reference letter should not be from your colleague, should be from the work center where you were worked. So these are the things you need to know. And also, if you have any mistake in your application, after sending, the ADC will check it and they will mail it, need to correct it. So most of the things happened is there in name, because in our passport name there is an elaborated name, for our surname. So here they will ask to submit a certificate from your college and your or from village. You need to submit that, both are one person. So this is the thing. Then next one is arrange document, from good standing certificate from your dental council. So here I am from Kerala Dental Council, so they send this good standing certificate directly to Australian Dental Council. So if you are applying the good standing certificate, there is a email ID. So there is in the ADC Connect where we need to submit our good standing certificate. So the good standing certificate not sent by personally, it's sent by Kerala Dental or any other state dental council directly to the Australian Dental Council. So next one is processing time is only 8 weeks. So within 8 weeks they will complete, and after you pass the initial assessment, it will valid for 7 years. It will valid up to 7 years. Okay. Within the 7 years, you can you need not to renew it, and within the 7 years, you have to complete your practical and written exam. So that is the thing. And cost is Australian dollar 647, that is about 35,000 something INR. So the eligibility is basically, initial assessment is you hold a 4 year full-time university dental degree or diploma from a recognized university, and have held full unrestricted registration or license in either your home country or country of training with no withdrawal of registration. So this is the eligibility criteria they put in their site. So next one is written exam. Written exam, if you are passing your initial assessment, then is the written exam. So initial assessment is actually starting 6 months before the written exam, and they will end it about 3 months prior to written exam. So written exam is actually in per month, per year, two written exam they will help, they will arrange. So one is in March and one is in September. So March exam is already over, and September exam is will be coming. So here, the written exam, the questions are actually scenario based question. I have put a question here. We can check it later. So here, the written exam is actually in held in 2 days, and per day there is a two session. So each session there's a 70 question. 70 question means 14 scenario, 1 4 scenario, and per each scenario, there is 5 individual MCQs. So the totally 70 question. So total question is 280. 280 question. That is 56 scenario. So this is the examination uh, framework, written examination framework. So if you pass means you can get either A grade or B grade. That will we can discuss. So this is the examination framework. Total 280 question. That means 56 scenario per day. Two session. Each session there is 70 question. 70 question means 14 scenario. 1 4 scenario. Each scenario have five MCQs. So this is the thing. So the examination day 1, there is session 1. So 70 question, that's a 2 hours. 70 question for 2 hours. Then there is a break. Then next to section 2, and that's also in the day 2 also. So this is the thing. And next one is the exam centers. So written exam centers are there in India also. The centers are New Delhi, Lucknow, Ahmedabad, Chennai, Bangalore, and Mumbai. So you can attend written exam in India itself. So the ADC uses scenario-based multiple choice MCQ question, and the cost for written exam is 2,122 AUD. That is about 1,15,000 something INR. So this is the thing, and this the bottom, that one is the blueprint, that the subject we need to study. Basically no basic subject needed. Pharmacology needed, but no anatomy, no physiology, no that one general pathology, general medicine needed, emergency medical emergency needed. So basic that subjects not needed. Only clinical subjects are, they give much more value. So next one, this is the one question that I have put forward you for, because you need to know how the question framework is look like. This is actually a scenario. A 16-year-old lady with the HbA1c, so hemoglobin A1c levels 12 percentage on alendronate for osteoporosis, reports to you as she is unhappy with her current treatment. She has generalized attachment loss of 6 millimeter. So clinical attachment loss of 6 millimeter. So OPG provided, and recently splintered lower anterior segment, floating forward, diffuse apical radiolucency present for 34 to 36 region. She feels at her age she should remove all her teeth, smoked previously but quit. Diagnosis of her condition. So this is type of the question they will ask, and look at the option, look very similarity. So like option A, chronic periodontitis. Option B, acute periodontitis. Option C, plaque induced gingivitis. Option D, non plaque induced gingivitis. Option E, aggressive periodontitis. So here what we can do is, the clinical attachment loss of 6 millimeter means there is periodontitis, so no gingivitis. We can eliminate all the gingivitis options from here. So option C and option D are out. And option E is aggressive periodontitis. Age of the patient is 60 years. So aggressive periodontitis also we can eliminate. And the pattern of appearance of aggressive periodontitis is incisors molar. So we can eliminate that. Then next one is acute periodontitis and chronic periodontitis. Here the attachment loss is 6 millimeter, and also the anterior region is splinted and floated. So more tooth is involved, and also the attachment loss is 6 millimeter. So it is a clear case of chronic periodontitis. So that is the thing we need to apply. Our critical thinking is very important, and apply our factual knowledge to practical knowledge also. So next one, how they assess the examination questions is based on cluster. So cluster wise you need to clear also. There is a 4 cluster. Each cluster you need to score either A grade or B grade. First cluster is professionalism and health promotion. Second cluster is clinical information gathering, that we are taking history taking. We are taking information from patient, history taking. And cluster 3 is the diagnosis and management planning. So diagnosis, how you reach the professional diagnosis. So and treatment treatment plan. And domain C is the clinical treatment and evaluation, what you done to that patient. So this is the thing you need to know, you need to study cluster wise, you need to study, and each cluster wise they will evaluate your mark. Either cluster 1 you need to score A or B, cluster 2, cluster 3, and cluster 4. So each cluster you need to pass. And also if you are planning for ADC, you need to study 4 to 6 hours per day, because you need to you have knowledge, but you need to apply it into that scenario, because scenario wise questions we are unfamiliar. So you need to apply the critical thinking, our fact into the questions and reach the answers. So next one is, this is what I said. You need to pass cluster wise. Each cluster you need to score A or B, and also the passing score is not revealed by ADC. It is only revealed after your exam result out, because the passing score is based on the easiness and difficulty of the exam. And A grade is your score was more than 10 percentage above the passing score. If your score are more than 10 percentage above the passing score, you are a clear pass. And if your score are within above the passing score, close pass. And your score are within 10 percentage below the passing score, close fail. And your score is more than 10 percentage below the passing score, is clear fail. This is the thing. So the passing score ADC not revealing, so you need to study, and which is based on the easiness and difficulty of the exam. So next, this is a written exam. Then next one is the practical exam. Practical exam, actually practical exam, I discussed a lot of candidates who passed the exam, and they said that practical exam is easy compared to written exam. I don't know why they are saying like that, but but they are saying like that this is practical exam is easier. Here, practical examination are held over 2 consecutive days. First one is technical skill day. Second one is the clinical skill day. Technical skill day, um, uh, technical skill, you need to cut the for amalgam preparation. You need to tooth preparation for crown. So that are the thing you need perform in technical skill day. Clinical skill day, it is nothing like that. It's a OSCE. So here one of the interlocutor will act as a patient, and you need to take history. You need to ask. Here I will put some examples here. Here these are the thing they will ask, like taking history from the simulated patient, explain diagnosis and management plan to that simulated patient, and establishing risk profile for simulated patient, and communicating health promotion strategy to that simulated patient. So simulated patient is our invigilator, so you need to be practiced, because they are finding loophole to fail you, because that is happening. So here technical skill is like a, you need to prepare for caries tooth. So here it is taken in typhodont, so mankin. So you need to provide caries tooth and non caries tooth. So you need to prepare amalgam preparation for caries tooth, and prepare tooth for resin composite, and also amalgam, and also access preparation. So access cavity preparation. So here these are the thing you need to perform in technical day, technical skill day. So OSCE is totally 10 station, and the technical skill is six tasks we need to perform. They will ask six tasks to perform. So after examination they will assessing like this. So here the complex amalgam restoration, they will assessment is like very good, satisfactory, borderline, and unsatisfactory, like that. If the preparation restoration finish is optimal smoothness, it's very good. So some areas roughness, satisfactory. Some areas roughness require correction is borderline. So excessive roughness that cannot be polished is unsatisfactory. So this is the way they will mark each preparation in technical day. So here, this is the clinical day, clinical skill day. Clinical skill day is OSCE. So 10 station. So combined clinical information gathering station, combined diagnosis management planning station, and combined clinical treatment and evaluation station, and effective communication. So you have an effective communication with your interlocutor, and also infection control. So here this is the clinical skill day. And technical skill day, six tasks we need to perform, and combined restorative based tasks and preparation based tasks. So this is the practical examination. So next question is English proficiency test. So English proficiency test actually needed, but not before. It's actually after the practical exam. Before registration you need English proficiency test. So actually OET and PTE are preferred test, and IELTS also can take. So IELTS overall score of minimum 7 each of the band, each of the component, like listening, reading, and speaking, and minimum score of 6.5 for writing. And PTE is also minimum overall score for 66 for listening, reading, and speaking, and minimum score of 56 in communication skills, writing. And OET, I prefer you to OET, because OET there is a role play in speaking. You can get a better idea to speaking in face of an interlocutor. So I personally prefer OET. OET dentistry. So here the minimum score in each of be in each of the component, like reading, listening, and speaking, and minimum score of C plus for writing only. So English proficiency test is needed. This is end of the this process. And after completing all these things, you need to register with AFRA. AFRA is the registering body for all the medical professional, including nursing also. So you need to registration with AFRA. And if you are practicing as a dentist here in Australia, you can stay here. Or if you are practicing in New Zealand also, you need to register their dental council, and you can work there. There is no any other formalities. So this is the thing. So hope you are clear with get some idea about the ADC and the licensing examination. And if you any of the students who are interested in this licensing exam, they can stay in this group, because Idendu is also offering licensing exam preparation. So that's the thing. Thank you. Hello. 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 If you have any doubts, also you can clear. Hello. Hello. Okay, Philip. Thank you. Thank you so much. Hello. Is anyone have any doubts regarding the ADC exam and any other licensing exam like NDB? You can ask. So, someone asked a question like that, ma'am, what source to refer to preparation? Actually, there are specific study materials for ADC. Actually, it's available in Idendu. um like more of the are guidelines like therapeutic guidelines, infection control guidelines, radiology guidelines, and also British dental journals, Australian dental journals. So these are the not textbook based study. This is actually some more elaborate study. So the study sources are with the Idendu. If you are interested, you can join Idendu's app. Their licensing exam group. So that's the thing. Okay, hope you on which visa we can appear for practical exam. Okay, after you clear your written exam, you can apply with your card, that passing card, to immigration. So you can get a visiting visa. So for practical exam, you can get a visiting visa. Okay, hope you are clear. So thank you.